All right, so feel free to let me know if anything's not working for you, if you can't see someone on the screen. But for now, I'm assuming everything is working. So I just want to say welcome, first of all. Thank you all for spending an hour with us here at the Masters of Health and Public Interest. We're really happy to have you here today and talk a little bit about our program. So without further ado, we'll jump right into it. So first off, we're going to introduce ourselves, who we are in relation to the program. We'll talk a little bit about the program itself and what makes us unique from things like public health programs, MPHs that you may see at other schools. We'll talk about career opportunities and alumni outcomes, look into admissions, what to expect when applying and financing your degree, and of course, leave time for Q&A at the end for people who have kind of more specific questions. So first off, my name is Jennifer Jansen or Jenny Jansen. I use she, her pronouns, and I am the program coordinator for the Health and the Public Interest program. What that means is I'm the advocate for both prospective and current students in the program. I'm that person that helps you from applying to the program to graduation, matriculation. So feel free to reach out to me if you have any specific questions after this presentation about applying, financing a degree, what offices and resources that Georgetown offers, kind of anything in those realms. I'm that person who can get you connected to other people within the program and the university. With that, I will pass it off to our two co-directors who are on the call with me today, Dr. Few Berman and Dr. Myers. I believe we will start first with Dr. Myers and then go into a bit of who our faculty are.
Hi, it's a pleasure to be here talking to you about our program. I hope you get what you're looking for out of this presentation. If not, please stay in touch with us, contact any of us in the future. So I'm the co-director of the program with Dr. Adrian Fu Berman. We share the role of basically running the program, doing admissions, all of those types of things. And both of us teach in the program. My teaching role is running the seminar series for the fall and the spring semester. And you'll hear more about that series later on. I'm a longtime medical center professor, researcher in the area of cardiovascular physiology, but these days my activities are mainly centered around this program, as well as the Addiction Policy and Practice program, another one of the interdisciplinary science programs of the grad school. So with that, Adrian, would you like to introduce yourself?
Sure. I'm Adrienne Fu Berman, so co-director of the program. I'm trained as a physician. So I'm in the Department of Pharmacology and Physiology as well as the Department of Family Practice. And I run a project called Farmed Out that does research and education on how the pharmaceutical industry manipulates prescribing practices. And I take care of a number of gardens on campus. And just a few words about our other faculty as well. Yulia Chinsova Dutton is a cultural psychologist, and she runs our summer course that begins the program, Health, Disease, and Society. So that course is it's sort of it's a pre-fall course, so it's a 3.5 week course that can be done remotely, and is it's a really great course that has an anthropologist also teaching and a sociologist, and it gives a really great gives a great introduction to social sciences. Tony Shalley is an OBGYN and reproductive toxicologist who teaches theory and methods of epidemiology. Lynette Golding teaches in communications. She's actually works full time at Save the Children, but actually flies in from where she lives in Georgia to teach a really great course. And Pam Saunders teaches theory and methods too, which is of epidemiology too. So it's more on the qualitative side of research. So we want our students to be very interdisciplinarily trained. And Dr. Sarah Marver teaches our biology of health and disease course, and Dr. Turbat teaches health economics. And Dr. Sherman teaches in biology of health and disease. He's a biochemist and an expert in nutrition. Dr. Weinstein um, teaches, she's a demographer and teaches various electives. I think this is someone else's.
Okay, so let me just say a little bit about Georgetown and we can answer questions later. But Georgetown is a great place to go to school in Washington, D.C. Students engage with actually a community of students, faculty, alumni from a range of backgrounds, experiences within these interdisciplinary programs. Our courses are designed to focus study on real world experiences and problems and to empower your personal and professional growth. You have opportunities to apply what you learn to become a leader in your chosen field. We're rooted in Georgetown's Jesuit values. Georgetown is a Jesuit Catholic university. The main effect of that on our graduate program is that we teach you to think, reflect, and act with intention according to some of the principles of the Jesuit order. For example, caring for the whole person as well as the value of education for all. So next slide, please. So why the HAPPY program? So HAPPY is kind of a unique program. In a lot of ways, it's like a public health program, but we look through health policy and public health from a lens that specifically looks at non-clinical factors that affect health, the societal, psychological, and cultural factors, economic factors that interact with corporate and institutional influences. And within our curriculum, we emphasize critical thinking, analytical, and research skills. The challenges that we face today as a society, as a culture, really require creative solutions, looking at problems from many viewpoints, not just what you usually see in health policy, which focuses very much on politics and money, at least in my humble opinion. So our curriculum consists of core courses that you can see here. We have the Health, Disease, and Society course in the pre-fall session. It's actually a fall course, but our program starts at the beginning of August. As you'll see, there's a health advocacy course that Dr. Fu Berman teaches in the fall semester, a biology of health and disease course, which brings everybody up to a certain standard of understanding basics of health and disease. Health economics, Dr. Drabot looks at some of the fundamental factors that affect the healthcare system and health from the standpoint of economics. Then we have methods courses and an important health communication course. Next, please. So next. So Adrian, do you, or I guess Jennifer, do you want to go to this?
Yeah, I can. So essentially, looking at our program as a whole, our goal is to teach you to be an advocate for a rational healthcare system and policies, and to understand a lot of the non-medical influences that surround health through policy, through kind of social justice and advocacy, through reform, all of these kind of outside factors, as Dr. Myers was talking about. For full-time, our program takes a year approximately, although we do offer part-time options as well. It is a 30 credit program, which translates to 27 core course credits, 6 elective credits, which gets to about 2 classes. Usually classes are 2 to 3 credits at the university. And finally, a 3-credit capstone project where you can work with national and local leading healthcare organizations. You can do a sort of research project. Dr. Myers and Dr. Feuberman will talk about that a bit later. But yeah, other things to note with our program is we are closing in on our official tuition rate for the academic year of 2025. However, it is not fully confirmed yet. So this is the tuition rate from last year, which was around $60,000 and $2,000 per credit. But keep in mind that that is likely going to be subject to the 4% tuition increase that happens across the university each year. So if you're calculating, just keep that in mind. And another thing that's interesting about our program that we'll discuss in a bit is our seminar series, which counts for around a course credit for students. They'll take it every Wednesday virtually in the afternoons. And those include presentations and discussions with public health leaders. We've had things about social media and healthy choices and peer pressure. We had a colleague from the Global Health Department talk about his work working with the United Kingdom government and the Ebola outbreak when that was going on. We have kind of a breadth of kind of health topics and people who are approaching them from interesting angles, and these are open to the public, as we'll talk about later. So we definitely recommend signing up for those if you're interested and want to get a sense of kind of what our students are learning and the questions they're asking. All right, so we have our full-time and part-time schedules to discuss.
Yeah, so as I said, the summer course is in August, and it's just right before the fall semester begins. That part can be done remotely. We just wanted to give the students the option of not quite moving into town yet if they didn't want to. And then fall and spring are all in person. So epidemiology, biology of health and disease is really it's a great course. It's primarily for students who don't have a strong biology background. So if you have a biology degree, you would be exempted from this course. Health advocacy is a course that I teach. It's a very hands-on course where students learn to write op-eds, they attend advocacy events, they do a group advocacy project, they assess advocacy groups. It's a very fun course. And seminar is really a highlight of the whole program. We have a weekly seminar. You're actually welcome to come and see what it's like. The students do the moderating. Dr. Myers does an incredibly great job in bringing in internationally known speakers to the seminar. And the reason that it says 0 to 1 credits is we want to give the students some flexibility in their schedules. We have you'll be taking 2 or 3 electives over the year generally, and that's really great because it enables you to sort of tailor your program to specific interests, whether it's women's health or bioterrorism or whatever it is. We have lots of courses across the campuses at Georgetown, and the electives will allow you to focus on specific topics. So that in the spring, there's the qualitative research course, health economics and health communications. Seminar continues. Everybody takes an elective in the spring. And then there's capstone, which is or internship, which usually happens the second summer. There's some flexibility with that. Some students end up doing it the next fall. A few students start their elective in the spring, but that can be quite a heavy load. It's the equivalent of 6 weeks full time. So it can also be done part time for longer, and we have a lot of opportunities available to students, and students have found some pretty amazing capstones on their own. Next. And this is a sample part-time schedule. We've had students do the program over 2 years. One student who had a baby in between took about 4 years to finish the program, but she finally did. I think she's the record holder for how long it took to complete. Next. And these are just some sample electives. This is not a complete list at all. We have many electives. Next. And these are some examples of capstone projects or internships that students have done. Zoe worked with a researcher at NIH. Daisy worked with Farmed Out and exposed the overpromotion of a dangerous drug for Parkinson's disease. Patty Bencivenga also worked with Farmed Out on a dangerous Alzheimer's drug. There are different internships available with researchers at DC, at Georgetown, and Felicia Reed worked with a researcher at Georgetown. So did Kelvin Blade, and Olu also worked with a researcher at Georgetown doing international work. Next. And these are some other possibilities as well. So people have worked at nonprofits, they've worked in government agencies, they've worked in private industry, they've worked for polling groups. So there's really been a broad range of capstone projects. So we would help you get a capstone project. And as I said, sometimes students have found them on their own, but we're there to help. Next. Adam, do you want to talk more about the seminar?
Sure. So these are just a couple of the seminars that we had in the past year and a half. The talk on Ebola was an interesting one that has implications for monkeypox and other possible things that are floating out there right now. Dr. Fauci presented to us on his experience with HIV/AIDS and the more recent epidemics. He's currently at Georgetown, what they call a university professor. It's a kind of a special designation for distinguished faculty. So the seminar is essentially a way to supplement what's in your courses, to bring timely new things to your attention, to also to tailor the program again toward your needs. If, for example, you're interested in women's health, there are electives to take in that, as Dr. Fu Berman was implying. So you could take 2 or 3 electives that relate to that. We could also we have opportunities for students to suggest seminar speakers. So we typically do get 1 or 2 people who talk about women's health issues anyway, but that's another place that you can tailor your program. Sometimes you can tailor it through your advocacy group project as well as your capstone. So it's really, the program is a great way to learn about health and healthcare, and at the same time specialize in a particular field of your choosing. I would recommend that any of you who are interested in coming to our program sit in a seminar or 2. They occur on Wednesdays at noon on Zoom, and they occur most of the academic year. We'll be finishing up with 1 or 2 seminars after Thanksgiving, and then we'll resume again in late January. Next slide, please. Oh, and also you can observe previous seminars. For example, Dr. Fauci's on YouTube or through our website. There's a link. Next. So my video is lagging. I assume it's going to pop up. Here it is. Okay, so do you want to talk about alumni, Adrian?
Yeah, sure. Our alumni have, this is actually a picture of two of our students, Kelvin Blade and Sophie Phillips, testifying to the FDA remotely, and yeah, on I can't remember what they were testifying on some drug or other. But Kelvin's now a PhD student at Hopkins, and Sophie's working after working at Public Citizen for a couple of years, is now working at Doctors for America, which is a really great group. So some of our students have gone to work in nonprofits. Some have gone on to additional schooling. We've had a few students go on to medical school, a few students go on to law school. One student decided she really wanted to become a social worker. But most students, go on into jobs either in private industry, in government, or in nonprofits. And this is a partial list of some of the places where our students have gotten jobs. Next.
All right, so now I will talk a little bit about what to expect when applying for the program, financing your degree, and then we'll move right on to your questions. All right, so firstly, here is a handy little application checklist of the things we require. You can feel free to screenshot this or take a picture if it's helpful to you. This is all handled via an online portal for the Graduate School of Arts and Sciences. So the first thing you'll need, of course, is a completed application form. Next up, we require an application fee. If you are applying to the priority deadline of January 15th, then this fee is waived, so that's a nice thing to know. Next up, we require a 500-word academic statement of purpose. This is just a place where you discuss your academic journey, what brought you to apply to the program, what you hope to get out of it, things along those lines. Because we're a small, very kind of advocacy and community-oriented program, we also strongly urge our applicants to fill out the optional personal background statement. This is just another 500 words that gives you an opportunity to expand on your experiences and how they contribute to your interest in the field. And it also gives you a great opportunity to show that you are going to be an active contributor in our community, because this is something that we really value as a program, and we really just like any opportunity to get you know you more through your application. Next up, we require a writing sample. This is just used to assess your preparedness to write at the graduate level. So it does not need to be tailored to the application. You don't need to write something new. Most commonly, students submit research papers or capstones from their undergraduate degrees, but we also welcome more professional papers like op-eds and technical reports. Anything you feel like kind of showcases your writing skills, maybe your research and analytical skills, you can submit there. We will also require your resume and curriculum vitae, and also 3 letters of recommendation. If possible, we would love to have at least one of your recommenders be an academic you've worked with, like a professor. If you are someone who is a couple years out of your undergraduate degree, maybe, and this doesn't seem possible for you, that's okay. We will accept responsible individuals from a work environment. But if you're someone who's closer to your undergraduate degree or maybe completing it right now, we'd really love for you to aim for at least one of them through a academic. The other good thing to know here is we will accept the names and the emails of the recommenders by the deadlines. So they don't need to have their letters in by January 15th or our final deadline of April 1st. You have a couple more weeks to coordinate that. Just give us their names and their emails in the portal. The other good thing to know about the portal is it will send them email instructions on how to complete the letters. You can send reminders to them and check the status of those letters in that portal. So that's a good thing to know. Finally, as soon as it's available, we'll need a transcript with your undergraduate degree on it if you're currently completing it. That's a common mistake people make when they are completing, say, their bachelor's degree. They may get an official copy of their transcript that doesn't say they've completed the bachelor's on it, so make sure to check for that. But like the letters of recommendation, we will accept an unofficial copy by these deadlines. We just need the official one in order for you to be matriculated and start classes, just so we can make that final decision with the graduate school. So keep that in mind. But for now, unofficial copies are fine. And for those of you who are non-native English speakers, we require a demonstration of English language proficiency. You'll see on the right the minimum scores required to be eligible for admission. However, if you attended a school where the primary language of instruction was English, this fee is waived, as we're assuming that you're proficient in completing your studies in English. You'll also see that we do not require a GRE test. All right, so what do you need to do to be considered eligible for the program? Firstly, you have to have completed a bachelor's degree or equivalent from an accredited institution. Again, it's fine if you are still completing it now. We just need you to have completed it and have proof you completed it by the time classes start. Next up, as we said, this is a very passionate cohort. We really love what we do. And we love people who are equally enthusiastic. So demonstrated interest in public health related fields such as healthcare, health equity, health reform, and advocacy are all strongly preferred. Other kind of social sciences experience, maybe things like psychology or neuroscience are great too. We just love to see through your academic work, volunteer work, internship, etc. What really draws you to this? What you feel like makes you stand out as an applicant? And finally, the Graduate School of Arts and Sciences requires a minimum GPA of 3.0 on a 4.0 scale. However, with all of this being said, you'll see in that bottom corner there that we conduct a holistic review of applications. With our size, we really want to get to know our applicants and what draws them to the program, and we acknowledge not everyone has the same professional or academic journey as well. So if you are concerned about any of these eligibility requirements, we really encourage you to reach out to us via my contact info, our phone number, which I'll put up at the end, or our program email, which is hapi@georgetown.edu. Because in the case where applicants are kind of otherwise very strong candidates, we can make appeals to the university. All right, as I mentioned before, we have 2 deadlines for application to the program. Applications are currently open for the next cycle of 2025. The first one is the priority deadline. This is a great deadline to hit for a number of reasons. The first one being that the application fee is waived. That's $90 back in your pocket. The second one is that this gives you priority merit aid consideration. Everyone who applies to the program is automatically considered for merit aid. You don't need to submit any more documents to be considered eligible. However, we're working with our full budget the closer we are to kind of the open of applications. So having that priority gives us kind of more time to fully consider your need. And finally, for international students, this is good because it gives you a couple more months from matriculation to figure out coordinating travel, visas, etc., because those always take a little bit longer than you think. We will continue reviewing applications after that deadline, however, on a rolling basis until April 1st of 2025. For both of these deadlines, classes will begin at the same time, which is August 2025. For non-priority applications, the application fee is $90, but or else, otherwise it's the same. Another good thing to know is when you're applying for admission to the program, apply to be admitted for fall 2025. We have an August sort of pre-session course, but this does not count as a summer course. This counts as a fall pre-session. So fall 2025 is what you want to hit on your application. All right, so let's talk a little bit about financing your degree. As I mentioned, we are closing in on confirming the tuition rate for the academic year 2025, but it's not here yet. We apologize for that. But keep in mind, the numbers on the website will probably go up about 4%. Other good things to know is, as I mentioned, we offer limited merit-based scholarships. It's really good to hit that priority deadline for full consideration of need. Other good things to know are that the majority of students finance their degrees through multiple sources, like employment benefits and outside external fellowships and scholarships. We have a number of offices for admitted students that are really great at connecting people to those resources. We have a specific office for graduate fellowships and scholarships. They have a great website to check out for admitted students that has information on like good times to apply to programs, and different scholarships, what to know when applying. And we have 2 career centers that can give you help with kind of applying to those resources. One of them is the Graduate Career Center, which is here in the Car Barn, where my office is located. And the other one is the Colley Career Center, which is a little bit more geared towards undergraduates, but still open to you. In fact, one of our students credited them with helping her secure her job out of graduation. So definitely still open to you. And those ones have a great number of resources to find and apply to external funding opportunities. A good reason why we have our program try to accommodate part-time students as much as we can is because a few of our students use employer tuition benefits to fund their degree. So if you are currently employed right now, definitely check in with your employer and see if you are eligible for some sort of tuition benefits. Most of our courses are after 4 and 5 p.m. To accommodate working adults. So that's a good thing to know. If you are eligible for Veterans Affairs benefits, you can contact the Georgetown Veterans Service for more information on starting that application process, and you can also schedule appointments with them on their website. We also encourage students to fill out the free application for federal student aid in the US, which will be available for the next academic year starting on December 1st, which is coming up. As a grad student or incoming grad student, you would be eligible to submit the FAFSA. This could find you eligible for federal low-interest student loans, or you could be awarded federal work study, which would allow you to apply to specifically designated work study positions on campus. So we encourage people, since it's free, to just fill it out, see if you're eligible. There are also a number of opportunities to work part-time on campus. Students are eligible to work up to 20 hours part-time while pursuing a degree at Georgetown. And a lot of different organizations and departments across the campus hire people working in different programs. I have someone from the environmental management, a master's program, working on me with these programs right now. We've had students work with research assistant, teaching assistant positions in other interdisciplinary programs like communications, culture, and technology. So I can definitely kind of talk to other program coordinators, see kind of what positions they offer. Another one we have is the Center for Social Justice has a number of paid interns in specific fields like sexuality studies and environment that do really great things there. And finally, another thing to know is the Georgetown Office of Revenue and Receivables offers monthly installment payment plans for tuition through their office. You can sign up for this through the regular billing portal for Georgetown. All right, so I've talked a lot, so I just want to say thank you again, everyone, for spending your hour with us. And we're going to open it up now to any questions you all may have. I'll stop sharing for a second. You're welcome to go off of mute, raise your hand, chat, whatever works best for you. We'll start right away with Emma, since they were quick to it.
Hi, thank you so much for you all sharing. My name is Emma. I'm this in this like application cycle. I'm applying for multiple programs at Georgetown. I wonder if we have or if there is a possibility I can work with a dual program and how's the schedule look like?
We
So
don't
could you,
currently have a we don't currently have a dual program at the moment.
yeah, so
Oh,
these are one year programs that are it's tough to complete these programs in 1 year. It's a full-time thing, so there really is an opportunity to take this the same time you're taking another one. Although, if you're a undergrad student, there may be opportunities to during your senior year take one or two courses from our program. Depending, you could talk to us about that. You're currently a Georgetown student, is that right?
no, I'm not the Georgetown student. I'm just applying for the Foreign Service Department master as well. When I'm applying for this program. And yeah.
Yeah, so probably the best that we can do is if you're in a different program, you can take some of our courses as electives in that program, perhaps. We welcome students in most of our courses if they're qualified, regardless of what program they're in.
Okay, thank you so much.
Sure.
All right. Anyone else? Feel free to raise your hand, go off of mute, or type in the chat if you have a question.
Hello. Given the typical course schedule during the semesters, is it possible to complete the program full-time or in 1 year while also working full-time? I just wanted to know if that's recommended by the faculty.
We definitely don't recommend it. So many of the students have part-time jobs. Most of the students um, who have full-time, we also have students who have full-time jobs, but they're usually taking the program part-time. We had one student who worked full-time and did the program full-time. And I think it was really difficult and stressful, and I don't think she would recommend it.
Okay, that's helpful. Thank you.
Yeah, and to just delve in it a little bit deeper, it's certainly possible to work full-time and be part-time in this, or to be full-time in this and to go down to part-time in your job. But just full-time and full-time doesn't really work.
Okay, thank you again.
Any other questions?
So one of the questions that we're often asked is, what's the difference between our program and an MPH? And maybe you could benefit from a little bit of explication of that difference. So an MPH is a specific accredited degree that's most often taken by people who are already in the workplace, taking it for career advancement or some other career-related position, career-related purpose. Many schools that offer MPHs have a Master of Science in Public Health or some other degree along with their MPH. For example, at Hopkins, they have such a course, and people who are straight out of undergraduate school are usually guided toward that program as opposed to their MPH in the Bloomberg School. So it's not unusual for people to get degrees that aren't labeled MPH, but are very much like them. In essence, the MPH is a great degree for people who want to join, or want to continue or advance in the public health workforce as it currently exists. Oftentimes they're employed as policy researchers or statisticians, epidemiologists, those kinds of jobs. Our degree is different. Let me talk about commonalities first, that we do offer methods courses that aren't as perhaps technical as the ones in an MPH degree. We offer the health communications course, which, health communications is often part of an MPH degree.
Oh, and I just want to say that was actually, we didn't used to have that course, but the students asked for it, and we ended up incorporating it.
Right. So, I won't go further into that, but there are some courses that are common to an MPH program. But, the main thing is that we're looking for people who aren't really looking to fit in or continue a traditional public health career. We're looking for people who want to be change agents, who really aren't satisfied with how the healthcare system, the insurance system works here. We had one student whose main goal in being in our program was to work for, a one-payer system of health insurance in the U.S. We're not particularly interested in training students for those sort of MPH-y kind of jobs. What we want to do is train people who want to look at things in a more multidisciplinary way and be the change, to delve into the system with your sleeves rolled up and do things differently and do things to improve the system that currently exists. And that goes for things that have to do with world health, international health, etc. A lot of our students are interested in those kind of things, or women's health. We can accommodate those interests while working with you to develop the tools that will allow you to be a strong advocate, to advocate for new and better ways to do things, and to treat the underserved of the world, the people who are left out of the current systems. So any other questions or comments?
Yeah, thank you for that explanation, Adam.
Sure.
If anybody thinks of any other questions, please feel free to reach out to us.
Yeah, I've kind of noticed that, since the election, people are kind of sitting back and doing more listening than talking. And, I understand that's a good thing possibly, but feel free to send us emails, come to our seminars, talk to Jenny, email all of us, and find out what it is you're looking for. So I do see that Ling Zi has a question.
Hi, thank you everyone for the very informative sharing. I'm Lindsay from Singapore. So I would like to understand for the course schedule, what is the class schedule like? And are most of the classes on campus and in person?
Yes, most of the all of the classes are on campus in person, except for the beginning class, the 3.5 week course in the summer. And most of the classes are we're trying as much as possible to have classes be after 3 or 4 p.m. to accommodate the students who are working during the day. So my class is at 4 p.m. The theory and methods of epidemiology classes at 4 p.m. So we're trying to have as many as possible. It be late afternoon, sometimes going into the early evening to accommodate working students.
Thank you. For like a typical week, would it be like almost 5 days a week on campus?
No, there's usually no classes on Friday unless you take an elective that meets on Friday. But it's unusual. Neither students nor teachers like to teach on Friday. They not like to have class on Friday. So usually Fridays are free. And sometimes the courses can be grouped, but I'd say actually, Jenny, you'd probably be better able to handle it. I think most of the time students are on campus about 3 days a week, sometimes 2, right?
Yes, we usually have like one class a day, like Monday through Thursday. So students will be in Monday, Tuesday, Wednesday seminar is virtual, so you wouldn't have to be on campus for that, and then Thursday in person again. So usually around 3 days in person and 1 day virtual for like once you've completed that kind of pre-session course for a full-time student. And in terms of, I think you also asked like courses that people like. I think health advocacy is a pretty popular one. It seems like a kind of unique offering in that students get to design their own advocacy project based on an issue that really speaks to them. And I think it's also nice that with seminar we get a lot of different speakers for like different topics that students are interested in. Like one of our most recent ones was a new speaker who was talking about water justice and Native American communities in the United States. And one of our first ones was Kenda L. Sutton, who talked about reproductive justice in Black communities and how she's training people to become doulas around, I think, the DMV region.
That's
so I think
District,
those are some
Maryland,
of
and
our,
Virginia,
yes,
for those of you who aren't from here.
yes, yeah, not like the car.
For those of you who might not be, this is a common question that we get about, when are the classes and how can we coordinate it with jobs and how many days a week, et cetera. Another way to look at this is, as undergraduates, you typically have lots and lots of time in class and distributed over 4 or 5 days a week. But in graduate school, you tend to take less credits in a given semester. So, for example, in our program, you have 3 credits in the pre-session in August. And then for the main semester, you have 12 hours, 12 credits, which translates to only 12 hours of classes, right? In spread over 4 or 5 days, maybe 3 days. So you're not spending a tremendous amount of time in classes. Spring is the same, and then you have the capstone in the summer, which is 3 credits. So you're not necessarily in class a lot. There's a lot of studying, reading, project work, meeting with other students, etc. So you're much more in charge of your own schedule, and you also have the liberty to design your schedule, at least as far as electives, so that you have more free time on certain days if that's what you're looking for.
Thank you so much, Adam, Adrian, and Jennifer. I have another question. Can I understand if the capstone project is a compulsory requirement for graduation?
Yes, it is. And there's a lot of flexibility around what it is. So some are more like internships or like jobs. Occasionally somebody does an independent project in, with a faculty mentor. And sometimes it's working in a lab or working closely with a researcher. It can be done in the US, it can be done internationally. So there's a lot of leeway.
Thank you so much.
Mhm.
No problem. Right. Any other questions?
Okay. Well, feel free to contact us if you have any other questions. We'd be happy to answer them.
Hope to
Yes.
see you in seminar, and good luck in your search to find a good graduate program to meet your needs. We hope that you continue to consider us.
Yeah, thank you again. I've put my contact information and the program contact info up on slides if you want to look at that. We have my email and our program phone number, and also the program email, hapi@georgetown.edu. Any of those are good to reach out to me if you had any questions about today, want to get added to the seminar list. Some other things we offer are meetings with the program directors, tour around campus. We have an in-person session coming up for those of you who are in the area or traveling on those dates on November 22nd from 3 to 6 p.m. We're having a kind of open house. And yeah, have a great rest of your afternoon. And feel free
Bye.
to check out our social media too for more seminar links and to see what our students are doing.
Oh, Tatiana's asking how to attend the open house.
Yes, so the open house, you can reach out to me and I can send you the link to register. Essentially, you just kind of sign up to register and then you can show up on campus. We'll be meeting in the Car Barn building, which is on Prospect Street on our kind of main campus. So that's a kind of in-person opportunity for people to meet us in person and also meet some current students.
Great. Hope to see some of you there. Bye-bye.
Alrighty. Yeah, hope to see you
Yeah.
there. And everyone have a great afternoon.